Okay. A biopsy of the affected lymph node reveals diffuse infiltration of atypical lymphocytes with high nucleus to cytoplasmic ratio. What is most likely? Um, so you have Lieber, Hodgkin, Mansell. Okay, so a 15-year-old man presents with fever, night sweats, weight loss. Physical examination reveals lymphadenopathy, splenomegaly, skin lesions, lymphocytosis with atypical lymphocytes. Serology of positive for human T virus in a biopsy. Uh, so, okay, I know the main question, but so I'm trying to see the relationship between this and this HTLV. So it just says we just test positive for it.
Mm-hmm.
So I'm trying to understand like what's the importance of that and the relationship. When I see atypical lymphocytes, I start thinking of EBV, and EBV is related to Burkitt. Um, and interesting. So I saw some keywords of the content I did know, and then about like what atypical lymphocytes mean. Like I usually see that with EBV. Um,
So talk to me what are atypical lymphocytes? Talk to me what does that even mean, right? I know we throw that term a lot around with, mononucleosis with EBV, right? Mono, right? But what does it mean like on a slide or, what does it mean by atypical lymphocyte?
uh, I'm not too sure. I mean, something I feel like in this case, I guess something malignant maybe, or something cancer related. There's some kind of dysplasia maybe.
Okay. So practically what it is, right? It just looks like they are, in a sense, right? Either reactive or practically they hold on, sorry, give me 1 second here. All right, sorry about that. So the key thing when it says atypical lymphocytes, right? It just means that in a sense it looks weird, right? And the way it looks weird under the microscope, usually it has high nucleus to cytoplasmic ratio. So if I were to draw this out, right? If here's a cell, right, and here's this nucleus, right, there's just a lot of nucleus to cytoplasm.
Right.
But why is this, why do they describe it like this? Because in mononucleosis with EBV, they do see this, right? But it's not because of malignancy, it's just a reaction of the lymphocytes to the EBV, right? And so that's something in your mind you want to kind of think about, right? And so they are described it to you as that, but what I'm trying to say is it's not only EBV that causes atypical lymphocytes. Does it make sense?
Yeah, yeah. So normally what I would do is technically I'd pivot and just think of like what EBV, like what cancer is like associated with it.
Okay.
Um,
But it says serology tested positive for human T lymphotrophic virus type 1 cell. It didn't say that it was an EBV virus, right? So if you went down that logic, then it's going to lead you to the wrong answer. Does it make
right.
sense? So
Yeah.
your answer that you want to kind of look for is something directly related to this question, not too far down. So I always say when you're talking about steps in logic, I want you to kind of, so if here's the question, the most amount of jumps in logic is 2 jumps, I say. If you're making that extra third or fourth jump in logic, then you're too far from the question if the question's here, right? And that means that your answer choice that you're going to lead yourself to is likely wrong. It needs to be within only 2 jumps of logic.
Okay. Uh,
You understand what I'm saying, right? You're like, oh, if it's atypical, then it might be EBV. If it might be EBV, then it might be Burkitt's. That's really like you're assuming a lot. You know what I'm trying to say?
right. No, yeah, that makes sense. the thing is with HTLV, I mean, I don't know too much about it, but if anything, I would say adult T cell lymphoma.
Okay, tell me your reasoning behind that. I like that, but I'm just asking you, what is your reasoning? Because then I can kind of help you with the test taking strategy.
Yeah, so I thought human T lymphocytic virus type was literally like that was kind of the same name as adult T cell lymphoma. So I was like, maybe this is like a trick or a trap or something like
Sure,
that.
sure,
But from my memory from pathoma, like there's like a vague little topic about it, and I think it's like helper T cell related or something like that.
sure,
But
sure.
um,
Exactly, exactly. I love your train of thought, right? I always say that if it's easy, pick the easy answer and it's usually correct, right? In my mind, right, when I see human T, right, in my mind, then I'm like, oh, it's likely a T cell lymphoma, right? Burkitt's B, right? Hodgkin lymphoma is very specific in certain things, right? Mantle is also B, right? And then they have different risk factors too. But the only one that should have HTLV should be this adult T cell. And I think it's the only one, right? So in our mind, right? So you got to be thinking, okay, what am I going to increase my chances of getting this question right? Does it make sense?
yeah, yeah.
Yeah. So that's
I
how
think
I'm trying to get you to, I'm trying to get you to think, right? Most direct, right? Most direct, most easy, most obvious answer, right? Because if you start going down that rabbit hole, right, then you're going to lead yourself very far from the answer choice.
yeah, I don't know if you have like a list or like a PDF of like your test strategies, but like the answer choice with like the two jumps in logic and stuff like that. I thought things like that I think are helpful too. So I don't know
For
if
sure.
if that just comes with like just doing questions with you, or if you have like, oh, follow these 5 steps for each question.
Yep.
But
Yep. So I'm gonna teach you that on this next one. All right.